بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Today we will talk about asthma. Today we will take introduction to asthma. What is asthma? Asthma characteristics, symptoms of asthma, testing and diagnosis of asthma, classification of asthma, asthma complications, causes of asthma, the goals of asthma treatment, asthma medications, and prevention of asthma. Before we start, asthma is a chronic disease that affects the airways of the lungs. It results from inflammation and narrowing of the respiratory passages, which blocks the flow of air into the airways, which leads to repeated episodes of shortness of breath with wheezing in the chest. So, asthma can be controlled through education and treatment. Through education by working with a school, and through treatment by asking a doctor. For instance, working as a team, school personnel, healthcare providers and parents can help children with asthma participate fully in school, sports and home activities. What is asthma? Asthma is one of the most common chronic diseases of childhood, affecting more than 6 million children. Asthma is a chronic inflammatory lung disease that can cause repeated episodes of cough, wheezing, and breathing difficulty. During an acute asthma episode, the airway lining in the lungs becomes inflamed and swollen. In addition, mucus production occurs in the airway, and muscles surrounding the airway spasm. Combined, these cause a reduction in airflow. For example, we have this picture. In the left side, we have this picture, the normal one. This is for people who haven't asthma. And the inflamed bronchial tube on the left side, this represents people who have asthma. Asthma is characterized by three airways. The first one, airway inflammation. The airway lining becomes red, swollen, and narrow. The second one, airway obstruction. The muscles encircling the airway tighten, causing the airway to narrow, making it difficult to get air in and out of the lungs. The third airway, it calls hyperresponsiveness. The muscles encircling the airway respond more quickly and vigorously to small amounts of allergens and irritants. Symptoms of asthma: breathing faster than normal or trouble breathing, wheezing or noisy breathing, coughing that may be worse at night or early in the morning, feeling tight in the chest, having a fast heartbeat, having head congestion, having an itchy, scratchy or sore throat, being tired. If your doctor ordered a peak flow meter, having a drop in peak flow meter readings. You may have more sign of asthma if you have allergies, if you have a family member with asthma, if you are sensitive to air pollution, if you are exposed to smoke, if you have stress.
Steps in testing and diagnosis. An asthma diagnosis is based on several factors, including a detailed medical history, a physical exam, your symptoms, and overall health, and test results. There are two ways to diagnose asthma. The first is physical exam. In physical exam, your doctor may examine your nose, throat, and upper airways. Another way to do the physical exams is to use a stethoscope. Your doctor may use stethoscope to listen to your breathing. Wheezing is one of the main signs of asthma. And the last way to do the physical exam is to examine your skin. Your doctor may examine your skin for signs of allergic conditions, such as eczema and hives. Another way to diagnose asthma is through tests. Your doctor may use a spirometry device. Spirometry is the main test doctors generally use to diagnose asthma in people 5 years or older. On the right of the slide you can see a picture of spirometry device. Second, lung test in children. These tests are for children under the age of 5. And the last test is the exhaled nitric oxide test. It is device similar to a spirometry device, but smaller in size. Classification of asthma. To classify the severity of your asthma, your doctor will review how often and how severe your signs and symptoms are. Your doctor will also review the results of physical examination and diagnostic tests. Determining the severity of your asthma helps choose the best treatment. The severity of asthma usually changes over time, which of course requires adjustment to treatment. Asthma is classified into 4 general categories. The first category is mild and intermittent. Mild symptoms that last up to 2 days a week and up to 2 nights a month. The second category is mild and permanent. Symptoms appear more than twice a week and not more than once per day. And the third category is moderate and permanent. Symptoms that appear once a day and more than one night a week. And the last category is acute and permanent. Symptoms that persist throughout the day on most days and often occur at night. Complications. In this slide, I have written all the details of asthma complications. Asthma complications include signs and symptoms that interfere with sleep, work, and other activities. Sick days from work or school during asthma flare-ups. A permanent narrowing of the tubes that carry air to and from your lungs. Bronchial tubes, which affects how well you can breathe. Emergency room visits and hospitalizations for severe asthma attacks. Side effects from long-term use of some medications used to stabilize severe asthma. Proper treatment makes a big difference in preventing both short-term and long-term complications caused by asthma. Causes of asthma. There are two causes of asthma. The first and the most is the genetic factor, and the second causes is cases of asthma resulting from the instructions of environmental life. A medical study conducted by researchers showed that the genetic factor is cause of most cases of asthma, and the study indicate that a large proportion of asthma cases are caused by life's environmental interactions, including airborne allergens such as pollen, dust mites, mold spores, pet dander, or particles of cockroach waste. Respiratory infection such as the common cold and certain influenza types. Physical activity. During physical activity, you will often breathe more quickly through your mouth, causing cold and dry air to travel to your lungs. And other cause is cold air. And the last cause is air pollutants and irritants such as smoke and pesticide pollutions from agriculture.
Okay, and thus I will talk about the goals of asthma treatment, and we have 5 points. And number one, to get rid of the symptom of asthma at night and day, and the patient can sleep comfortably without the pain as in the past. Number two, free from any restriction on daily activity, so he can practice his daily life such as sport, eat food, and other activity without obstacles. Number three, not having to go to ambulance. Number four, eliminating the use of bronchodilator frequently because the bronchodilator it affects the lungs and cause infection if the patient use it for a long time or too much. And number five, to get the best measure of the ability of the air. Okay, next move to next slide. Here we talk about asthma medication, and till now there is no medicine or device that can completely eliminate asthma, but there are some devices and tablets that help the patient to do his life normally. And let's start with inhalers. Inhalers devices that let you breathe in medicine, and it work to relax the muscles surrounding the bronchi, which leads to opening them wider, and thus effectively and quickly relieving the symptoms of an asthma attack. And inhale it's the main treatment. After that come tablets and tablet steroids. Inhalers can help you in relieve symptoms when they occur, stop symptoms developing, and some people need inhalers that does both relieve symptoms and also stop symptoms at the same time. Okay, move to next slide. And here it's the second medicine, tablets, and you may also need to take tablets if using an inhaler alone as the inhaler doesn't help you or doesn't work. And there's the main tablet they called LTRES, and it's abbreviation to leukotriene receptor antagonist, and it's the main tablets as we say. And they also come in syrup and powder, and take it every day to help stop your symptoms occurring. And that's also there's side effects include tummy aches and headaches. Okay, let's move to next slide. Uh, the third medicine is steroid tablets, and steroid tablets may be recommended if the other treatment are not helping to control your symptoms, and they can be taken either as an immediate treatment when you have an asthma attack, or take it every day as a long term treatment to prevent symptoms, and that usually used only necessary if you have very severe asthma and hails, because the steroid tablets it have a dangerous effect to the patient. And here, long-term or frequent use of steroid tablets can cause side effects, as we say, and such as increased appetite, easy bruising, more changes, fragile bones. Okay, let's move to next slide. And here we can talk about the prevention of asthma, and we can prevent the asthma through cooperation with the doctor. It's possible to make a program that the patient follows to prevent asthma, and here we have some step that can the patient follows. First one, writing a program of work for the treatment of asthma. The second, identify and avoid factors that cause asthma. 3. Respiratory monitoring. 4. Identify and treat seizure at early stage. And it's very important to identify the symptoms or causes of the disease uh, uh, and early to prevent the disease from developing and becoming dangerous. And after that, it's impossible to treatment the asthma.